Hey everyone, happy Monday. My name is Dr. Lizette Sunday. I am the owner of Compete Physical Therapy and Wellness here in the Fargo-Moorhead area. And today we're answering a question we got on Instagram. Firestein would like to know, how can the hips cause back pain? And back pain not necessarily from a disc issue. So this is a great question, and it's something that I see really commonly. As we talked about last week, the hip is very stable in anything in weight bearing. So it does everything from helping us stand to helping us push up from a step to helping us push up out of a squat. And even in athletics, helps us with things like running and simple walking. Look at that hip extension. So if your hip lacks the mobility to come back to do some of those motions, or if it lacks the strength to push up out of some of those motions, your back will naturally compensate and do that for your hip. Here's that same hip extension motion that we've been talking about. But if I lack the motion or the strength to lift it up, you can see how my back naturally goes into an arch to help it. This causes excess strain on the low back. If you're not sure whether your hip has a mobility problem or a strength problem that might be causing your low back pain or your hip pain, because that can happen too, then a great way to get this assessed is to get an athlete movement screen or go to a physical therapist. If you do happen to go to a physical therapist for your low back pain and they do not check your hip, run. I'm Dr. Lizette Sunday, and I hope that this has been a beneficial Mobility Monday.